here at Revalla Plastic Surgery, and today we're going to be talking about liposuction. So have you all struggled maybe trying to work out and diet and exercise and not able to slim down in certain areas? Well, one of the things that we have available to us is liposelection by Vaser. And so the Vaser device is an ultrasound-based technology for minimally invasive treatment that you're able to treat large areas with little tiny poke hole incisions. And so we've been doing this for 20 years. The nice thing now is that we have been able to bring this into our office and be able to do in-office procedures. One of the benefits about this is you don't have the hospital experience. You don't need to go through all the screening and contact. So right now with COVID, where everyone who has been struggling with COVID is being treated in the hospital, we actually can perform procedures without having to have that hospital exposure. So we're excited to have this here. We've been doing this for over 20 years, and it's a tried and true proven technique that will work great to contour you, shape you, and give you the shape you're looking for, even if diet and exercise may not have helped in the past. So one of the things that I really like about Vaser, as opposed to traditional liposuction, is that it's able to target fat much more specifically and treat it more gently. The other thing is the surrounding tissue is preserved so that you have better sensation. The great thing about Vaser also is that you can get skin retraction and tightening, because if you reduce fat in an area, you may get some skin laxity. The thing you want to do is be able to tighten it simultaneously, and with a Vaser we can do that as well. So one of the questions people ask is, what areas do you treat? Is it the whole body, or what are you doing? So really, anywhere where you've got fat, this is a wonderful treatment. The neck, I think this is one of the things that most people struggle with as we age. We get heavy in this area. The Vaser works wonderfully to help with tightening and reducing fat. Arms, the belly, the back of the hips, on the thighs, the knees even. And another area that most people don't realize is the breast. And so there are some cases where we can do breast reductions completely by lipo, and so you have only little tiny poke hole incisions instead of having big large incisions, where in many cases that's all that's been offered to patients. And so really you want to see your doctor to evaluate whether or not this could be a great technique for breast reduction. One of the groups that really doesn't talk much about this is in the pediatric population, because there are lots of young teenage girls who have very large breasts, and we don't really want to go to the OR and injure their breasts in a way that maybe they can't breastfeed when they're older. And by the way, they haven't even finished developing. This is a great technique to help reduce the breast in very tiny incisions and leave the breast mound alone, so that they can get back to doing more exercise and activities that they want to. And this is a wonderful procedure until they've finally finished childbearing and breastfed and finished development. This is a great procedure for young teenage girls as well. So if this sounds like something that is interesting to you, then I would suggest you make an appointment, give us a call. You can either call us at 720-283-2500, or you can go on the web at revalla.com and contact us there as well. But I think you'll do well to come in and let us show you some pictures so that you can see the before and after, so we can determine if this is the right procedure for you.